Hi, my name is Latoya, and this is my podcast, Let Your Hair Down, where we talk about everything. So be yourself at all times.
So yeah, I mean, up until I talked to the doctor, I was very scared that I had because the doctor that they gave me, that's his specialty, is like one of the rarest, most deadly cancers known to man.
Mm-hmm.
That happens in your white brain matter. That's his specialization. So when I looked that up and saw that, I was freaked out. And until I actually sat down and talked to him and told me, it's like, no, you got it's
Mm-hmm.
a cyst and they're generally benign. That relaxed me a little bit, but still the idea of somebody cracking open my head and going all the way into the middle of my brain is
Okay.
a little unsettling.
So for our listeners who quite understand what colloid cyst is and where it's located in the brain, can you just kind of, help us to understand, because it's not just on top of your brain, but it's where the way it normally generates, it is very scary. Could you get us a little bit more into the brain where exactly it is?
It's in, yeah, in your brain you have ventricles where your cerebral spinal fluid flows.
Mm-hmm.
You have four ventricles, like you have four ventricles in your heart, and it was in the third ventricle, which is towards the back of the brain.
Okay.
Um, they are where the two hemispheres of your brain come together. The ventricles are there, and that's where your cerebral spinal fluid flows through. Now,
Mm-hmm.
my particular cyst was not in the normal spot to find one. It was back further in the chamber, which allowed
Oh,
it to get bigger. And it was about the size of the tip of my pinky,
wow.
about 2 centimeters by 1 centimeter by 1 centimeter. And it hadn't yet cut off the flow of the cerebral spinal fluid, but if it continued to grow, it could have, and that's when it becomes an emergency because the brain continuously makes the fluid. So it's kind of like having glaucoma in your eye where the fluid has nowhere to go. So it just continues to build up and the pressure in your brain builds up. And because your brain is encased in your skull, it has nowhere to expand. So all that pressure is pushing out on the inside of your brain. And it can cause strokes and aneurysms, cause sudden death,
Mm-hmm.
lots of things that it could cause, which was the reason to get it out to begin with.
As such an
Um,
urgent matter, as such an urgent, it was an urgent matter, based on what you had told us, because as soon as you find out, it was like MRI after MRI, and the doctor was like, okay, yes, we need to go ahead and get it out. So we just want to listen to know that is don't delay. Make sure you go right to see a doctor. But how did you research your doctor?
well, originally when they thought it was on my pituitary gland, they were setting me up with a surgical team that's all they do is pituitary tumors.
Mm-hmm.
Now, that would have probably been worse if it was a pituitary tumor because it more than likely would have been cancer. Um, so it was a blessing in disguise because it wasn't. I got this other doctor assigned to me, and I
Mm-hmm.
looked up his name and I started doing some research on him. And most of these doctors, they have papers that they've written. They and you can find out information on them. Um, but like I said, his specialization. When you look him up, his specialization is that cancer. He's an oncologist,
Mm-hmm.
uh, but he specializes in that particular type of brain cancer that is extremely deadly. There's no cure for it. So when
Oh.
I saw that, I was like, oh my God,
Mm-hmm.
wow. Um, and that, like I said, until I actually sat down and talked to him, that was what was foremost in my mind.
Mm-hmm.
And you can't be healthy mentally when you're thinking that you're going to die.
Okay.
Um, it's a hard place to be in, and not something that you really want to have to experience.
Mm-hmm.
Um, so like I said, going through trying to find information about once I found out that it was a cyst, I was a lot more relaxed because they're generally benign.
Okay.
Um,
I just want to jump in quickly, Barry. For those who are just joining us for the very first time, we're basically talking about colloid cyst, the diagnosis, the treatment, and the recovery. And we're here talking to our dear friend Barry Hammond, who have just gone through the operation in 3 weeks post surgery. And I'm glad that he's here to share his story, even though it's just 3 weeks. Barry, just want to ask you, how long was your surgery?
from what I understand, it was 10 hours. To me, it seemed like 10 seconds. Um, I was originally told that it was going to be about 3 to 4 hours.
Hmm.
I don't know if they ran into some troubles or what actually happened, but it wound up being more like 10 or 11 hours.
Okay.
Like I said, I mean, I went to sleep when I woke up. I don't have no idea on the time. That was at least the last thing on my mind. Um, but everything went well, in that so far my recovery has been really good. Pretty much pain free. I don't recall having
Oh,
any
wow.
really. I don't recall. That's another scary part, not knowing what to expect after the surgery.
Mm-hmm.
And with my surgery, I mean, they cut me open all the way across the top of my head here.
Oh, wow. That's a big
Um,
stuff.
yeah, with my surgery, I was on the pain medicine only for, I'm going to say, a week, maybe a little over a week, and it was mostly just Tylenol, and I didn't have any problems with pain
Hmm.
or anything like that. It's really been pretty good. The only problem that I have had is with my memory.
Mm-hmm.
Um, I'm missing like 2 weeks. I don't remember. I remember coming home, and then, like, if I was home for 2 weeks, I don't really remember it. I don't remember much of it.
Okay.
I do remember going to get my staples out. Um, but then from that point the to when I realized that I was missing 2 weeks was another like 5 days from that, 4 days, 4 days from
Awesome.
that. And yeah, I honestly thought that I had just came home from the hospital the week before. And when I was told it was 3 weeks, and I still can't recall those 2 weeks. I have no idea what happened that
Okay.
I was even home. I don't remember nothing.
So, Barry, I just want to ask you quickly before we wrap up. How was your support, your support system through this time?
It's very good, great. The doctors and nurses from the University of Pennsylvania Medical Center were outstanding. The entire team was absolutely outstanding, from the surgeon all the way down to the nurses. They were absolutely outstanding. When I come home, my family has been great. Been able to actually relax and heal, rest and heal. So yeah, I mean, it's been really great. And one thing I can tell people that are going through this is to relax, trust your medical professionals, um, and don't worry yourself too much, because that's what I did. I put myself into a tizzy, and I was just absolutely, I was to the point where I was sweating, scared to death, and you know really it was needless, because coming through on the other side, other than the loss of the memory, not a lot of pain,
Hmm.
not a lot of discomfort. um, they want me to take a test now so that I can do a baseline, and then go back in like 6 months and take it again to see if the my cognitive processes have sped up any from making new connections. But really, it's been It's been not too bad at all. Not what I thought it was going to be,
Okay.
and that's in a good way. So
Okay. So thank you, Barry, for sharing your journey with colloid cyst treatment and recovery. So for you and for all the listeners, we just want to thank you for tuning in, and we're going to go out now with Let You Hear It on podcast. Remember, tell a friend, tell somebody, share. This is a good story that somebody would really benefit from. Thank you so much and have a blessed day. Bye.